now in particular, the community mental health landscape is quite dire. Our community mental health providers, which are those that serve like low income and Medicaid, right at the current time, most of them are full and they're not taking new referrals. And so what that means is that that cadre of students doesn't have any support. And then you have students who have insurance who could in theory see a private practitioner, but those often right now either have really long wait lists or they are not accepting new clients. And so right now, just with the pandemic and the therapist shortage and all of that, it puts a lot more strain on schools.
I've received help from our school therapist, but this year our therapist is booked. There is no availability. She comes in once a week, so not everyone gets to meet with her. I have not met with her this year. I've had administrators just tell me that the therapist is booked and they can't submit any more requests. If I want to go in to see the therapist, that's not possible.
Hello, my name is Justin Irish, and I am the superintendent for the Anacortes School District. Now more than ever, we need your support in helping our students' social, emotional, and mental health needs. We are asking for your continued support to help us fund a K-5 social worker at our elementary schools, as well as continue the great funding to support the curricular needs at all schools in our district.
Yeah, there's absolutely a need for mental health therapists, even at the elementary level, because it's unfortunate, but some of these students are dealing with major things at home, things like witnessing domestic violence, unpleasant divorces. Kids need a lot of support, and that's another way that we can support families. Having one person that they can share those big things with, those big feelings, those big events, it goes a long way to being able to come through the other side in a way of strength.
The crisis feels more palpable and more serious. So yeah, we're seeing definitely more suicidal thoughts, issues of grief and loss, and you have a lot of issues around motivation and returning to routines and social isolation and then reintegrating. It's definitely alarming when the youth that we're seeing are struggling to the degree that they are. A lot of people need help right now, and there's only so many people in those positions to provide the help. We want to do right by our kids. We want to get them the help that they need. We want to serve them well. We want to make sure that they're safe and okay and well and getting the treatment that they need and that they deserve. We just need more people doing clinical work.
Just having maybe another therapist at the school or including another resource, something available for students. That way, these students that are asking for help can actually get the help they need. Some of these students don't get that support from their house or their homes. Students are struggling and there needs to be more done. We need to talk about it, in classes. I think that's the way to go.
We want to offer a social worker at our middle school, and we want to offer additional staff at our high schools in order to support our counselors in the work that they're doing each and every day for our kids. Please consider donating today. Your donations make a difference in the lives of our students, their social emotional needs, and their mental health. Thank you so much for considering donating to the Anacortes School District students.